South Africa, nurses in the country's public health sector have shown that quality healthcare doesn't necessarily come with the high cost of private medical care. Nurses at one of Cape Town's oldest public hospitals have recently garnered a number of awards for their innovative approach while tending to the needs of the sick and vulnerable. CGTN's Travers has more.
It's clock-in time and the day shift is about to begin. But before that, a bit of exercise to keep the mind in focus. These are the nursing staff at Travers Hospital, a public facility where the world's first heart transplant took place. And these lot are carrying over with that proud tradition. The hospital is one of the busiest in the Western Cape due to the high number of patients injured through violent crimes. And nurses here are kept on their feet all the time.
A teaching academic hospital. We work closely with the universities. Our staff is very experienced. They're continuously on the education drive. And if you look at the standard of work we do here compared to other hospitals, I mean, everybody's thriving. I can't compare now and mention hospitals, but I think Travers is always ahead of everybody else because we're continuously on this journey of innovation, do things differently.
The hospital employs over 1,700 nurses and recently scooped most of the awards for provincial nursing excellence. Wound care specialist Moira Kinnis was one of them. For her, the award is not just an endorsement, but an opportunity to erase many preconceived ideas the public have on the public health system.
It's very important for me to give the service in the public hospital to the patients, because a lot of our patients that can't afford the private sector. So most of them is pensioners and disability people. So it's really important for me that my service to them.
Travers is one of two local teaching hospitals where the next crop of medical specialists are nurtured, and the hospital was also awarded for its excellence in the transfer of important knowledge and skills.
I think the patients that come to Travers are obviously in need of care, and they have many conditions, and they're obviously scared when they come. So that's important for the nurses to know how to interact with the patients. And I think it's really, for myself, in terms of like the nurses that come after their training for community service, that they grow in their role and they can guide the future generations to come.
The Department of Health believes that through the dedication of nurses breaking traditional stereotypes of government-funded health, a new trend is emerging. They could see more and more private sector patients opt for cheaper state-run clinical care. There may be significant financial strain on public hospitals, but that hasn't stopped the more than 70,000 nurses working here in the Western Cape from trying to deliver their best service. And it is that commitment to doing their jobs well that is slowly driving people's faith back into the public health system. Travers, CGTN, Cape Town.